A patient on VV-ECMO for COVID-19 ARDS develops sudden gurgling sounds in the circuit and a visible air bubble in the venous line. What is the immediate priority? A. Increase the sweep gas to flush the air. B. Clamp the circuit and stop the pump. C. Put the patient in Trendelenburg position. D. Aspirate the oxygenator. Answer: B. Clamp the circuit and stop the pump. Explanation: an air embolism is a catastrophic emergency. The circuit must be clamped immediately to prevent air from entering the patient's circulation. Once the patient is safe, the air can be removed from the circuit by a specialist. Which electrolyte abnormality is most dangerous and frequently monitored during the initiation of ECMO? A. Hypernatremia. B. Hypokalemia. C. Hypocalcemia, ionized. D. Hypermagnesemia. Answer: C. Hypocalcemia, ionized. Explanation: citrate anticoagulated blood products or the prime solution used in the circuit can lead to rapid drops in ionized calcium, which is critical for myocardial contractility and the coagulation cascade. In neonatal ECMO, what is the most common indication for support? A. Congenital diaphragmatic hernia, CDH. B. Meconium aspiration syndrome, MAS. C. Persistent pulmonary hypertension of the newborn, PPHN. D. All of the above. Answer: D. All of the above. Explanation: while MAS was historically the most common, CDH and PPHN remain primary indications. Neonatal ECMO is highly successful for reversible causes of respiratory failure. What is the oxygenator failure test? A. Checking the patient's urine output. B. Comparing the PO2 of the blood entering versus exiting the oxygenator, postmembrane PO2. C. Listening for a loud hum in the pump. D. Measuring the patient's temperature. Answer: B. Comparing the PO2 of the blood entering versus exiting the oxygenator, postmembrane PO2. Explanation: a healthy oxygenator should significantly increase the PO2 of the blood. If the postmembrane PO2 is 200, 300 mm of mercury while on 100% VO2, the membrane is likely wetting out or clotted and needs replacement. Why is the right radial artery the preferred site for an arterial line in a patient on peripheral VA ECMO? A. It is the easiest to cannulate. B. It monitors the oxygenation of the blood going to the brain, carotid/brachiocephalic. C. It measures the pressure of the ECMO pump directly. D. It prevents limb ischemia in the legs. Answer: B. It monitors the oxygenation of the blood going to the brain, carotid/brachiocephalic. Explanation: in peripheral VA ECMO, the mixing point of ECMO blood and heart blood often occurs in the arch of the aorta. The right radial artery reflects the oxygenation status of the brain and heart, the north and north-south syndrome. Heparin-induced thrombocytopenia, HIT, is suspected in an ECMO patient. What is the alternative anticoagulant of choice? A. Warfarin. B. Bivalirudin, argatroban. C. Aspirin. D. Low molecular weight heparin, Lovenox. Answer: B. Bivalirudin, argatroban. Explanation: direct thrombin inhibitors, DTIs, like bivalirudin are the standard of care when HIT is suspected, as they do not cross-react with HIT antibodies. Avalon and Crescent are terms associated with which specific ECMO component? A. Types of centrifugal pumps. B. Dual-lumen bicable venous cannulae for VV-ECMO. C. Specialized oxygenator membranes. D. Monitoring software. Answer: B. Dual-lumen bicable venous cannulae for VV-ECMO. Explanation: these are single-site, dual-lumen cannulae that are inserted into the internal jugular vein. They drain blood from the IVC/SVC and return oxygenated blood directly toward the tricuspid valve. Which of the following is a relative contraindication specific to neonatal ECMO? A. Weight less than 2 kilograms. B. Gestational age less than 34 weeks. C. Evidence of grade 3 or 4 interventricular hemorrhage, IVH. D. All of the above. Answer: D. All of the above. Explanation: these factors significantly increase the risk of mortality or devastating neurological injury, making the risk-to-benefit ratio unfavorable. What is the primary risk of using VAV-ECMO, veno-arteriovenous? A. It is too simple to manage. B. Complex flow dynamics that can lead to differential lung/heart perfusion. C. It requires 3 different pumps. D. It cannot be used in adults. Answer: B. Complex flow dynamics that can lead to differential lung/heart perfusion. Explanation: VAV is a hybrid mode used when a patient has both heart and lung failure but also suffers from upper body hypoxia. Balancing the flow between the arterial and venous return limbs is technically challenging. During decannulation, removal of a femoral arterial cannula, what is the most critical surgical concern? A. Checking for a skin rash. B. Ensuring distal flow and performing a thrombectomy/vessel repair. C. Measuring the length of the cannula. D. Giving a dose of antibiotics. Answer: B. Ensuring distal flow and performing a thrombectomy/vessel repair. Explanation: because the arterial cannula is large, the vessel often needs primary surgical repair. Surgeons also check for clots that may have formed at the tip to prevent an embolic stroke or leg ischemia.